create these vision boards and these ideas in my head about what I want to do. And the blessing of a curse of my personality is I don't give up. One of the things was I'm going to be a VA psychologist. It just never worked out. And I was like, okay, I'm going to start my private practice. It was a blessing. It was just me. I'll do the things. And then it just started growing quickly. Yeah. And then people started approaching me about working with me. It's just grown.
How do you de-stress?
I work out. I structure my entire day. I'm really big on like calendars and planners and things like that. So I write out my entire day, including gym. Working out is a big thing for me. My support system obviously was going home. But I'm home. I'm not Dr. Huddleston. I'm Shun. I can take a step back and just be my normal self and don't have to think about anything about being a therapist.
As another high-achieving woman in the mental health space, what do you think we should do?
If you're not sleeping, if you're gaining weird weight, if your skin is dull, if you're not eating right, if you're not having time to exercise, that lack of contributes to you being stressed. More women in particular need to be able to say no. No is a complete thought. You don't have to explain yourself.
I'm gonna kick back when you say like that.
Welcome back to Beauty Unveiled. I am Dr. Angela Sturm, and today I have with me the beautiful Dr. Shun Huddleston.
Thank you.
She is a psychologist that trained at University of Houston.
I trained at University of Houston. I did my residency at Vanderbilt in clinical health psychology, and then I came back and I did a postdoc at Baylor College of Medicine. So thank you for having me.
Yeah, thanks for being here.
Absolutely.
I'm so excited. So we were both at Baylor, but probably
I was in the clinical research, VA, going back and forth across the street. It's a completely traumatic time. I'm just
for both of us, really. I was in the VA on the clinical side of everything. You know how you see everything. And,
yes.
For both of us, really.
Yeah, I was on the 6th floor.
Yeah. Let me see. Clinic was on, I think it was the second floor. And then I can't remember where the OR is. Somewhere in between there.
Yeah. So I was on the 1st floor, primary care, and on the 6th floor. So back and forth.
Yeah. You see everything.
I know.
All kinds of things.
I know. I wish I would have met you then.
I
know. That's awesome.
Yeah. So what brought you into the space? What made you go this direction?
Wow. So initially, I wanted to be a criminal attorney. So my favorite cousin, so she was 9, I was 7. She said she wanted to be one. Yeah. I have no idea why she said she wanted to be one. But I was like, oh, this is my favorite cousin. We can do this together. This is great. Yeah. So I was like, okay, go to school, do all the things. I was on the debate team. Yeah. I'm going around. Oh, I'm from Mississippi, by the way, Tupelo, Mississippi. Going around Mississippi, debating people. I have all the great grades. I go to undergrad and I hated poli-sci. I was I thought to myself, this is the most boring thing. I do not see myself doing this long term, but what I did enjoy was psychology. Yeah. And so it just made so much sense to me. Lots of great information that was applicable to all areas of life. And then as I sat and thought about my life, I felt like, especially when I was little, I was really shy and anxious. Just unsure.
You're shy?
I was. As a kid, I was. I was just a little shy, anxious kid. Quiet, just to myself, even though I have several brothers and sisters. I was just...
What number?
So I am the oldest on my mom's 6.
Yes. Oh, so you are the ringleader. Right. You're the oldest.
Right. So, just quiet kid. So I thought about that part of me and just wanted to understand that. Yeah. And then my mom's dad, when I was about in my junior year of undergrad, had been diagnosed with Alzheimer's dementia. And so that really placed a severe hardship on my family for so many reasons, particularly because they didn't understand it. And he had these episodes where he would kind of go in and out of knowing who we were, not knowing who we were. He declined quite quickly, on top of other medical health issues that he had. So it was just a hard time.
It's so hard for the family.
Yes, especially when you don't understand it. And so all those reasons culminated into me going to be a psychologist. And then the thing with psychology, you cannot just get a bachelor's degree because you will get no jobs.
Oh, really?
Oh, my God, you would never work. I'm making any money, not real money. Yeah. So I then, when I got my master's degree and PhD and started my private practice. So here I am.
Yeah. Yeah. So what brought you from Mississippi to Houston?
Graduate school.
Yeah.
That was the only reason. Grad school, and then life start lifing, and then I ended up being here long term. I love it here. Lots of great, amazing people that you meet.
It's a wonderful city.
Yes, it's lots of things to do.
You
know, great place if you have kids and fun stuff. So Houston has been good to me.
Yeah, it's a great place. And then you've grown your practice, and tell me about starting your practice and then how you've grown it. And
it's been a journey. So initially, I create these vision boards and these ideas in my head about what I want to do. And the blessing of a curse of my personality is I don't give up.
Yeah, no,
I do not give up.
The most important thing, I think.
So one of the things was I'm going to be a VA psychologist.
Yeah.
Okay. So I come up with these things, right? So my dad is a Vietnam veteran.
Okay.
So it all stemmed from that. I can remember when I was little, like around 9 or 10, him literally screaming in his sleep. Oh, so he had a lot of PTSD, nightmares, and things like that. And that's another reason too that added to why I became a psychologist, because I didn't know what that was. But anyway, thought I was going to be a VA psychologist. It just never worked out.
Yeah.
I tried and tried, just never worked out. And so I was like, okay, I'm going to start my private practice. And it was a blessing.
Yeah.
So I started, it was just me. It's like, okay, I can do this. It's going to be easy. I'll do the things. And then it just started growing quickly.
Yeah.
And so then I was like, oh my God. And then people started approaching me about working with me. And so that just turned into 1, 2, 3, 4, 5, 6 people later. And it's just grown. I even do some training. So I've had an intern before. So an intern is just you're finishing your PhD in psychology and you need to have a placement before you graduate and then subsequently go to postdoc. So I had an intern, and I currently just started with a postdoc who started about a month ago. Okay. So I really love to train too in my practice. So it just grew.
Yeah, that's awesome. So how did people find you?
Oh, wow. That's a good question. Insurance panels. That's one way, because
it's a good way to get started.
It's a good way to get started. Like, that is free advertisement is to get on insurance panels. I do understand, though, a lot of mental health clinicians do not want to be on insurance panels because it's complicated.
Yeah.
And sometimes the reimbursement rates aren't that great. So I get it. But I think for me, it was important for me to be on insurance panels to be able to reach the folks that I wanted to reach. Yeah. And also, if you have insurance, you probably want to use it. Yeah. And so I get that.
Yeah. We pay a lot for it. So.
Yeah, right. And I think the money will come.
Yeah,
I've never not had what I needed. The money will come. So, you know, it's been great to be on these insurance panels because of the free advertisement. And then, like, what else? I've gotten awards throughout the city. That's been helpful. I've had, like, little write-ups and things like that. I do a lot of just networking events, meeting folks, trying to do collaborative things, which has helped. Just being in the mental health space. So I do some work with HPA, which is the Houston Psychological Association, on their DEI committee. So that helps. So just being in different spaces and trying to connect, that helps.
Yeah, I feel like the networking is so important, because then you just get to know people and meet people, and it's and this person, then you meet someone else, and it's like
it just goes and goes. Yeah. I know, it's amazing, which is great about the city.
Yeah, it is, because everyone is so nice and helpful. They're like, oh, I have somebody. Let me introduce you to this person or that person. You know, it is. It's so collaborative and nice.
Yes, I agree. I agree. So yeah.
So as another high achieving woman in the mental health space, what do you think we should do that we don't do?
Oh, okay. That's a good question. Okay, a thing that we don't do that we should do: manage stress.
It's yes. Okay.
Okay, go.
How? Okay. Because everyone's like, oh, you're stressed and this, and I agree. And I don't do a good job of it, you know, and I think it's hard because so much is on your shoulders.
Oh,
you know,
absolutely.
Your business is on your shoulders, your kids are on your shoulders, you know. Like,
absolutely.
How do we do that?
Well, I think one of the things that I think so many people will say is, I'm not stressed, to your point. And if you're not sleeping, if you're gaining weird weight, if your skin is dull, if you're not eating right, if you're not having time to exercise, all of that lack of contributes to you being stressed. So paying attention to your body, acknowledging when things are tough, having some great outlets, go to therapy. Yes. Or even if you don't want to go to therapy, right? Just have some good spaces where you have people you can talk to and connect with. Take time off, rest. Rest is good. Like, it's that little saying, everything works better when you unplug it, even you.
Yeah.
That means something.
Yeah.
Right.
And you feel like we always think we have to keep going and we have to keep going and, and then you just burn yourself out.
Burn yourself out. Because you can't. It's not sustainable.
No, you can't.
So I would say definitely manage stress. And, like I said before, too, with the sleep, a lot of people don't pay enough attention to their sleep. These are things that can literally kill you if you don't pay attention to it.
Yeah, and I think women, like I saw this a lot. I was working with like the American Heart Association and that sort of thing. Is like it's something like 1 in 3 women is going to have heart disease, and we don't pay attention. We don't pay attention to the symptoms and the and all of those things that you said, like your sleep and your diet, and all of that contributes to it. And and we're like, I'm fine.
Right. And you're not.
Like, I'm done.
No, I'm not.
I'm good. Don't you need to go home?
No, I got it. Just 1 more hour. No, you don't. And it's okay to take a break and say no.
Yeah, say no.
Say no.
Is hard. That was one of the lessons for me of like getting to the point where I was like, okay, here's my life goals. And if it does not meet these life goals, I'm sorry, but I just can't.
Can't do it.
I maybe can suggest somebody that can, or you will find somebody that can. I just can't.
Right, absolutely.
I can't do it.
Right. More people, more women in particular need to be able to say no. No is a complete thought. You don't have to explain yourself.
Right.
I love to say no to people and just look at them. No. Makes everybody uncomfortable.
And just see what they say.
Just see what they say. No.
I love it. Art did that to me the other day. He was like, okay, I'm going to tell no because, and I was like, you don't have to tell why.
Right. Don't say why. Just say no.
Yeah. Just say, okay,
and look at them and just turn your head like you're like Chucky or something. And then they'll stop.
And
so,
then and that's enough. They don't have to know why,
But I think we all kind of get caught up.
Yeah. And the rat race and everything, and everyone's depending on you. And saw something the other day that was like, if your friends are upset with you because you didn't do something over the weekend, they don't care about you. They don't. Because there's times when I'm like, I can't.
Okay.
I need to lay on the couch with my babies.
That's it. Right. That's it. And watch cartoons. That's it.
Yeah, exactly. Watch their kids' movies, and that's what we're going to do this weekend.
Right. Absolutely. I love being a mom, so you're right. Yeah. Absolutely.
So how do you de-stress? What are your...
I work out
a
lot.
Yeah.
Because I need to. So I structure my entire day. I'm really big on like calendars and planners and things like that. So I write out my entire day, including gym. So working out is a big thing for me. I love to travel. So as often as I can, I am leaving this place. I love to spend time with my son. He's funny. He's creative. He's at an age where he still thinks I'm great. So we can go play basketball.
As long
as possible. We make cakes that we end up throwing away because they're nasty, but whatever, we made it
the
together.
Process was fun.
Right, the process was fun. He decorates it. It looks terrible, but it's fine. He doesn't eat it. And he loves to go to restaurants.
That's great.
Which is random. But he eats the same stuff, but it's fine. Yeah. But we go to restaurants together. I even like traveling with him. Like I love seeing how he experiences the world.
Yeah.
Right? Like seeing him, you take him to aquariums or doing all these other fun things, but I just love to watch how he experiences the world. So
it's like seeing the world through new eyes when they're like, oh my gosh.
Right. We forget that as like at these big ages. We forget that like we can still experience the world, right? And it would be great if we could through the lens of a child, and we don't. It's like, so to see him is the most amazing thing.
Yeah, you get to like experience it again.
Yes,
in a better place.
Absolutely. I love to sleep and I love to watch crime shows.
Yeah, see, it's the crime. It's
the
back in.
Right. I'm like, I would have did this, but I love watching it. Yeah.
So I watch. Get your opinion on this. Okay. A lot of people talk about like mindset and things like that, and none of them are moms, not a single one, that they're like, oh, I do these things. I manage my stress. I do that. And then, I'm digging into it because I was like, I don't think any of these people have kids. And so I was looking at it and
typically they don't.
And generally no, and you'll have found interviews and they're like, well, I'm childless by choice, which is totally fine. And I support anything anybody wants to do. But I'm like, where are the people that are hearing mom so many times it loses meaning? Right. I need that person to tell me, what are you doing?
Right. Right. Absolutely. Absolutely.
I don't know. Your thoughts on that?
Lord. I feel like having a kid is probably the scariest and most enjoyable experience of life. I know you can agree with that.
Yeah.
And so just trying to take it day by day. You know, even some of the things that Gavin has come home talking about has it sometimes like just wore me out and hurt my heart, right?
Yeah.
But just trying to stay positive, leaving space and giving myself grace.
Yeah,
Right.
exactly.
Right, because I'm not gonna get everything right, and I'm definitely not gonna get everything right as a mom.
Yeah.
Right.
Yeah.
So giving myself grace, giving myself breaks.
Yeah.
For my child, I love him very much, but we need a break.
Someone said that they're a better mom because they work during the day, and you have that little break, and that way they can be more present for them. And I was like, yes.
I agree with that. I 100% agree with that. I agree with that.
Then you can appreciate that time that you have, and you're not like
wanting to scream.
what?
Because some days, yeah. I mean, it's easier now that he's older, but when he was younger,
It's nonstop.
it was tough. The screaming for no reason, the falling out in Target, all the things, right? Because you're a kid and you're growing and you're figuring out the world, and that's fine and normal, but still, it's just a lot, right?
Yeah. Because these people are like, so I go for a walk on a Sunday by myself, and I'm like, no,
I'm not doing it because there's a couple people behind me. Right, I can't do that walk by myself.
I'm carrying a 40-pound kid because she's tired and she doesn't want to walk anymore.
Right,
I'm like, whose idea was this? It's hot and sweaty.
Right. I'm not opposed. I mean, Gavin has an iPad, and I am not opposed to giving him the iPad because I need a minute.
Yeah. You know, there are very educational things on
There
some
are
of these
tons of
iPads.
things, yes.
My kids have learned all kinds of things.
All types of things.
Spanish.
Yes.
There's letters and numbers.
Yes, Gavin does Duolingo. He does all the things.
Yeah.
It's fun. Right.
Yeah.
Right. And honestly, too, and I'm pretty sure you've experienced this with your daughters, the schools also give them computers.
They do.
It's not like they're only doing this at home.
Right.
They do this at school also.
Yeah. They learn, and everything we do here is on a computer.
Yes.
It's on an iPad. It's on a Surface. You know, so that's how our life works. So that's
correct.
And they're going to be way better at it, of course, as kids always are. You know, because they grow up with these things.
They
in their
do.
hands,
Very much more smarter than what I would say I was in those grades. But it's great.
I never want to tell people like when we actually had computers at home.
I know, so they know, or the
then
internet.
they can figure out age and
or the internet, or cell phones,
or cell phones.
Right.
I know. I was like, that was actually a very peaceful time. I would drive 8 hours from college to my parents' house. No cell phones, none of that.
Do you not know how much I use Waze
Everywhere.
to go? I know how to get to this office. Don't you know I still did the directions?
Every time.
And I'm like, well, how did I drive from Louisiana to Mississippi with no directions?
Nothing.
I'm just hanging out.
Yeah.
And nothing happened.
And everything was fine.
Everything was fine.
Yeah, it was fine.
Isn't that crazy? I could not imagine doing that.
I know, doing that now. Like, you're going to
I need Waze. I'm sorry, where you going? No, put it on your phone.
Yeah, I have to see the traffic and
everything.
all of the things. Yeah.
It's so crazy how the world is now.
Yeah,
But
I know.
everything's so accessible.
I know. And it's good and bad, you know, being accessible all the time.
Oh,
because
for
there's
sure.
times when, like, you just got to turn it off. And, you know, especially like marketing your business, people, you have to be involved with social media. And there's things you need to do your business. But there's like points when I'm like, I have to take a break. You know?
Yeah. Social media can be exhausting too.
Yeah.
You need that break just for so many reasons.
Yeah. Because it's just a lot, you know.
Mm-hmm. It is hard to keep up with those things too.
Yeah.
I mean, I know
it's
we
a
get
full-time job.
Fancy people in place to help, but still,
I know.
it's still a lot.
It still requires you because it's still your content and it's your business, and it needs to be, you know, from you. But it's.
I agree. Yep. I know.
Or then you get like the very generic post, or then I look at it and I'm like, oh, this is terrible.
Right. Delete.
Who did this?
I know. Right. Yeah. So you have to be mindful too of that point. Just like not over consuming yourself with social media stuff, having a good time to not be on it.
Yeah, exactly.
Or set time to be on it and like leave it.
Yeah.
This is just not healthy overall.
So our worlds kind of overlap a little bit as far as like plastic surgery, and it's a tough process, you know. It's wonderful and it's exciting, and you get to see people like feel better.
Absolutely.
But like going through the process sometimes can be hard. Have you dealt with some of our patients in general? You know, as
that's a good question.
You know, like that process of it being hard and like dealing with identity and who am I and what have I done?
Yes, clients and friends.
Yeah,
I have friends that they have gotten one thing and cannot stop. Right? And it's like, okay, what's going on there?
Yeah.
And even my clients that have gotten like different type of procedures, in the United States and internationally,
Right.
which is also a very interesting thing.
Yeah.
Right.
Yeah.
You go to Turkey to go get your nose done.
Yeah.
Right.
You're going to get the Turkish nose.
Right. You don't get a Turkish nose, and then you can't do anything about it once you get here.
Yeah.
So now what?
That's the problem.
Yes.
Yeah.
Right. There's no one you can go to. No, I don't think it. I don't. To my knowledge, understanding, you wouldn't mess with it. Right.
No,
you wouldn't
because
touch
you
it.
didn't do that surgery.
You didn't do it.
Yeah.
Right.
Exactly. So if everything goes great, fantastic.
Good for you.
There are
Right.
some amazing surgeons everywhere in the world. But if you're here and they're there, I hope everything goes wonderful.
Exactly. And that ranges from just like dental stuff.
Yeah.
I've had one of my clients went and got dental work and a tooth came out on the side.
Oh no.
So now we're dealing with this, right?
Yeah.
So now you're self-conscious. You have to go do trainings at your job.
Oh no.
You're trying to figure out how you can get back to Colombia. I don't even know what they would do out here. I mean, probably they could fix it, but I don't know.
Right.
But just to your question, those type of instances happen all the time, or even like some of the people I know have gotten like, lipo and things like that, and like dealing with the drainage, the change in your body, because it takes time. You don't, I mean, I'm sure you can see some visible changes initially, but the real change doesn't happen until months later, until everything has kind of resolved itself and you finish the lymphatic massages and things of that nature. And so like seeing them really go through, or the pain.
And the
right?
pain. It's the pain and the discomfort.
Yes.
And then you did this to look better, and you look at yourself and you're like, I don't know that it's better.
Right. I don't know
you
if it's better. I look the same.
Yeah.
Right.
And
or
then-
or the ones that don't want to like continue what's recommended because of that.
Yeah.
Right. And I'm like, well, you probably should do that
Yeah.
because you want the results. And I hope you spend all that money
Right.
to get the results you want. So you probably should go get those massages.
Yeah. Do the things that
Do the
were
things.
recommended, or
Keep
there's
your
a
chin
reason.
strap on so your chin can still do whatever.
Be that where it
Right.
needs to-
Do the things. Right.
Yeah.
So yeah, I've seen it several times.
Yeah. From a mental health perspective, would you have any advice to someone that's thinking like,
Oh, good question. Listen to your doctor. That would be it.
number one?
Number one, listen to your doctor. Get as much support as possible. It would be
Yes.
great
Yes.
if you found you a mental health clinician to help
Yeah.
you sort out the mixture of emotions that you're experiencing with these surgeries, because you're going to have them.
Yeah.
And just make sure you rest. I feel like a lot of people just try to jump back into things,
Yeah.
which also sort of interferes with that process. So make sure you do your due diligence in resting.
Yeah.
Yeah. So that's what I
The
say.
support is
Yeah.
so important. I
Absolutely.
think that's one of the biggest things for me, is if they have somebody that's supportive,
Yeah.
they'll be fine.
They'll be
you
fine.
know?
Yeah.
But if they don't have somebody, or they have somebody that's negative, that's like, no,
Right.
you know,
Right.
that's so hard. You're trying
Absolutely.
to heal, and you're trying to feel
Right.
positive on yourself, and then you have that, and it's the support is it's a
Right.
lot. It's
That's the biggest thing. Yeah. Yeah. Absolutely. I would agree.
at my old job, they had on the intake form, have you ever been in therapy? And they would go, oh, I'm like, I'm the opposite. I'm like, if you say no, I'm like, why not?
Why not? Right. Why not? Right.
What? Never?
Never. Right. You have nothing in your life has ever made you feel like, or even just upkeep, just having
Yeah.
somebody, just a safe space to talk.
Yeah.
Right. It's like unpack whatever going on with you. It doesn't have to be anything super critical.
Yeah.
To have a therapist.
Yeah, have somebody that
Yeah.
can listen and help you, like you said, unpack, think about things.
Absolutely.
Those are the people I worry about.
Right. Exactly. You should. You should. Absolutely. There's a lot of those people out here.
Yeah, they're like, I'm good. I'm like,
You're like, mm-mm, you're not. Do that first. Come back.
yeah, yeah. And I have done that. I had that talk with people. Like, let's get in a good place,
Yeah.
because change is hard.
It
and
is.
Let's make sure that's in a really good place, and then we can talk about
Right.
making these changes and
Absolutely.
feeling good.
Absolutely.
Pretty much everybody's been okay with that.
Yeah,
it's been
which is
rare that
good.
someone has not
Follow
been
through.
receptive. At least
Yeah,
So,
which is great. I think it's necessary.
you never know, because you feel like on that conversation, like, oh, are they gonna get offended? Or most people not.
Yeah, hope they understand.
Yeah.
Too. Yeah. And then the change, like you said, to your point, the changes too, especially when you get this new body and sort of what that means, attention,
Yeah,
wanted, unwanted attention.
Right.
So it's a lot of processing of different spaces and things that can be discussed as it relates to someone getting surgery to alter themselves
Yeah.
in some type of capacity, which is okay if you want to do it. I think it's great.
yeah. I'm definitely all for
Yeah.
it, but it's just knowing there all those things that go into it, because I'd rather talk about it beforehand than after. You're like,
Right.
dealing that and the emotions and everything.
Right. I agree.
So what advice would you have for someone that's young and is thinking about mental health and not sure, or, you know,
That's a good question.
What's your advice for somebody? Or maybe advice you wish somebody had told you?
Oh, okay. Advice I wish somebody would have told me. Okay. I don't think I think this ignorance, this was bliss, because if someone would have said, okay, Shun, you would be in school for 11 and a half years. I think I would have definitely said, I'm going to say no. I can go do something else. So that part.
Yeah. Transparency of
like that. But, you know, I was so young. So I was like, oh, I could do anything. I could go. I'm just going to go do it. Right. Not thinking how much of a big chunk of my life.
Yeah, a very important part of your life too.
All my 20s.
Yeah,
right?
exactly. Yeah.
A couple years of my 30s. So I'm telling my age, but yeah, it was a long time. So that part, and then what else would I would say? I personally felt like graduate school, I don't want to say a hazing process, because I feel like that is too much of a term, but it was a lot. It's a lot of hoops to jump. It's a lot of things in which you have to prove yourself, your competencies, really making sure you have good experiences and skills and things of that nature. I'm thankful that I was trained well, and I was able to, I wanted to go to Vanderbilt. I went to Vanderbilt. I wanted to go to Baylor. I went to Baylor. I don't give up, remember? So I'm going to make sure I go and do the things.
That's what successful people do.
You do. You just never give up. So that part, and just, you know, just stay committed, you know, stay committed, work hard, you know, take care of yourself. Yeah. I think a lot of people lose sight of that in these programs. They, you know, they don't sleep, they eat terrible, they don't work out, they don't rest. So, you know, making sure you take care of yourself, I would say that, and like just have a good support system too. You know, like having those people that can just, for me, my support system obviously was going home. When I'm home, I'm not Dr. Huddleston. I'm Shun.
Yeah.
And I love that.
Yes.
I love that I can take a step back and just be my normal self and don't have to think about anything about being a therapist or showing up in a certain kind of way. I can just be relaxed, and I needed that.
Yeah.
So having those type of things. So yeah.
Yeah. I think we all need that you know, different spaces where you can just relax and you can be yourself and you can turn it off a little bit.
Turn it off. It's like a good home base. It's my home base.
Yeah.
So
Yeah.
make sure you have that support system.
Yeah. Absolutely.
I agree.
Well, thank you for coming on. This was so fun. I appreciate it.
Thank you for having me. This was a great conversation.
This was really fun.
Yes, it was great. I loved it.
So if you enjoyed this, please like, share, follow, share with your friends. You can find this on wherever you find your podcasts, Spotify, Apple Podcasts. You can find me at www.drangela.sturm.com or on any of the social medias at Dr. Angela Sturm. And where can they find you?
Thank you for asking. So my website is www.newwaypsych.com. Also, that is my social media handles for Instagram and Facebook. So New Way Psych, you'll find me. Thank you.
Thank you so much.
I appreciate it.
And thanks for listening.